You go to the doctor, surgeon especially, you want to do your homework. We're talking about your body, your health. You want the best of the best, the creme de la creme. I like board certified. In this case, we got a gun-toting trauma surgeon accused of sexual misconduct. Oh, joy. Oh, wow. That not exactly, we're not even getting to the board certified part now, are we? This is, I got on the medical gear. Let's go to Los Angeles. Trauma surgeon Dr. Louis Kwong facing allegations of sexual misconduct on unconscious patients, including claims he checked under the hood of one black male he was treating, according to 2 lawsuits alleging a racial, sexual, anti-Semitic atmosphere at a Los Angeles hospital. Kwong faces 2 lawsuits by 3 former female doctors who experienced horrors perpetrated by a powerful man on whose actions were protected for more than a decade by the highest levels of county hospital leadership. Lawyer Carol Gillum, who is representing all 3 women, said in a statement, "It's a long crime. No longer can Kwong threaten the careers of young resident doctors, medical students who might speak out about what happened inside his operating rooms. We will not rest until all are held accountable." The doctors alleged a culture of harassment against women, denials of promotions, appointments, reassignments, vastly less pay than their male counterparts in orthopedics, court documents said. One woman witnessed constant racial, misogynistic, homophobic comments and behavior, court documents said. She observed firsthand the retribution meted out by Kwong against those who didn't silently obey him, and then it happened to her. One doctor said her academic appointment to UCLA was put on hold under Kwong, and that she was removed from her position as the Orthopedic Surgery Residency Associate Program Director after administrators asked her to investigate a report that Kwong endangered a patient by watching a baseball game on the operating room monitors while operating on a patient in what court documents call the baseball incident. Do you see what I mean? When she returned from maternity leave, she alleged her office was locked. The locks had been changed. Her belongings had been moved into storage, and she was forced to share a freezing, inverted closet. Lawsuit alleges male physicians made crude remarks about female physicians, patients, and others. At one point, when the hospital CEO told Kwong not to comment about female colleagues' looks, Kwong allegedly angrily told his colleague that the CEO was a weak leader. Kwong also allegedly said at one point, men are either T or A guys, and that people think Asian men have small d. We're going to get to all of this, but I will say if all the CEO did under these circumstances and allegations is to tell Kwong not to comment about female colleagues' looks, that's pretty weak to me. But we got to get to Kwong first. I'm just saying.
With millions watching and many people benefiting from this program called Indisputable, we just need 1% of the viewers to become a paid member so we can continue to bring this content to you. Now back to the show.
The lawsuit alleges Kwong was once allegedly so intoxicated he had to be removed from the operating room. My goodness. He was also a reserve LA County Sheriff's deputy and allegedly carried a gun in a fanny pack inside the operating room, the clinic, the office, and conference rooms. I mean, you see the picture. Why are you doing this, Dr. Kwong? I'm asking for a friend of a friend. Kwong allegedly engaged in other incidents, including lifting the drape of an anesthetized patient to look at his penis after being told it was large, according to the lawsuit. Allegedly measured the penis size of the patient using paper rulers, asked a medical student and a resident to guess whether a man's penis was over or under the length of the paper ruler, court documents said. Kwong once talked about how he cut his ex-wife's vagina to get his baby out, encouraged residents to marry his ex-wife and offered $100,000 to anyone who married her so that he would not have to pay her alimony, court documents said. Kwong also allegedly discussed erotic asphyxiation, discussed sex acts during surgeries. Court document said during a lecture for medical students and residents, he used depictions and diagrams of males and females to demonstrate sexual positions to use after hip replacement surgery. The lawsuit alleges. Why not just talk about the hip replacement surgery, Dr. Kwong, and leave something else to another colleague who specializes perhaps in that? I don't believe you specialize in it, Dr. Kwong. There's so much going on here. I don't know when you had time to operate because you were doing much of it, apparently, allegedly, outside the operating room. Give you a little bit more because with Dr. Kwong, apparently there's always more, isn't there? We're learning. We are learning. In an incident reported in 2019, Kwong allegedly lifted surgical gowns. We talked about that, right? Where he looked and measured the size of the penis. Okay. Unconscious black man's penis. Time said he allegedly discussed the genitals of the day. Dr. Louis Kwong is no longer an employee of LA County, where he worked as an orthopedic surgeon at Harbor UCLA Medical Center in Torrance, California. County officials confirmed in a statement emailed to Law and Crime on Tuesday. After all, that's what you're saying? He doesn't work here anymore? It sounds like he put in a lot of work. Not the kind he was hired to do. What? There's so much here, Woz. Where do you start? There it is. It's yours. Carry on.
I mean, obviously, this guy was fostering just an extremely toxic work environment. And nobody should have to work under those conditions. We've all had jobs. We've all had friends at our various jobs. And if you are legitimately close friends, you and that friend can participate in horseplay and sharing maybe a joke or two that's off color, whatever. You and that one person that you may have established a very good rapport and a genuine friendship with. You don't then take that and apply that to literally every single person on the job site. It doesn't make sense, or in the workplace. That's not how a professional environment should be, conducted. As you mentioned, the guy got fired. I would hope, because it usually takes a lot for these guys to lose their license. It's like really hard for doctors to lose their license. I would hope that this guy is made to do some level of penance. I don't know if it's counseling or therapy or whatever. And I would really hope that this would follow him into his next place of work so that it could be monitored. Like, is this guy behaving himself in a professional manner?
Yeah.
Has he moved on? They said he was showing up to work and maybe operating on people, while intoxicated. He might have a substance issue. I would hope he's getting that rectified. But man, when people go to the doctor, there's literally no more vulnerable a state to be in than in the hands of a doctor. You're putting your actual life in their hands, and that this guy was behaving this way, literally doing a penis measuring competition is beyond the pale, obviously.
Yeah. If I were to make a mistake, I don't know, more than usual, here filling in for Doc, maybe I go too far. The network might say you're suspended or something. That would break my heart. I'd try to do a good job. I love TYT. Now, if I were in the operating room, though, like Dr. Kwong, watching a baseball game with my, I'm strapped. Why are you strapped? And what are you doing, Dr. Kwong? What are you doing? Remember Joan Rivers? Have we forgotten how she passed away? Selfies in the operating room and jokes being had. I don't know if they could have saved her, but that didn't help, did it? Didn't help. So there's that. But you mentioned, Woz, that You hope it follows him. He gets some help. If he was fired, we don't know that he was even fired. The statement is Dr. Louis Kwong is no longer an employee of LA County where he worked. Da, 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 da. That signals to me, there's my little spidey sense. I haven't had much carbs today. And I'm some dipping in and out my blood sugar. So, but right now I'm okay. Okay. And my spidey sense tells me that he wasn't fired. He reached some kind of agreement. And as part of it, they probably won't even be able to go to the next level and tell a future employer that this surgeon is kind of out there and watching baseball. Who's your team, Dr. Kwong? Who's your team? I'm team patient and protecting lives. And I'm not even a doctor.